We often forget that there are people who are more affected by the pandemic aside from us. They are people with disabilities. They are more affected by COVID from a health perspective because they are more vulnerable with the virus. From an economic perspective, because a lot of people with disabilities have lost their jobs. Even in terms of education, they find it difficult to participate in distance or online learning. This needs to be a concern because the protection of disability rights has a legal basis, which are Law No. 19 of 2011 concerning the ratification of the Convention of the Rights of Persons with Disabilities and Law No. 8 of 2016 concerning persons with disabilities. In this case, various ways to deal with COVID-19 have been carried out by various parties, ranging from socialization of prevention, provision of public facilities for sanitation, vaccination, special health facilities for COVID-19 to social assistance. But are all these facilities accessible for people with disabilities? It turns out that there are three main challenges that hinder the fulfillment of disability rights during the pandemic. Among them, first, the data collection for persons with disabilities has not been maximized, resulting in the fulfillment of social protection being hampered. In reality, many government assistance programs are not evenly distributed to all persons with disabilities because there is no integrated data on persons with disabilities. It can be seen from the survey data conducted by various institutions that there are still many differences. This data collection is also difficult to do because there are still many people with disabilities who are still reluctant to report themselves, as well as there is still a negative stigma so that many do not have an ID number, including information about the type of disability. The data is not integrated and has not been recorded in the population so that many people with disabilities have not been involved in the development process, including Social Security. In addition, the laws and regulations have not been synchronized. Not all technical regulations have been issued, and many local governments do not yet have local regulations so that the fulfillment of the rights of persons with disabilities in the regions is not optimal. Second, access to public services, information, and communication that do not meet the needs of persons with disabilities. Some counseling videos about COVID-19 do not yet have a sign language interpreter for the deaf, not to mention the health facilities that have not been maximized for people with physical disabilities. Another example, a poster published on social media is also not accompanied by a word version of text that can be read with a screen reader to ensure that the information in the poster is understood by the visually impaired. Third, the implementation, planning, and monitoring of policies for persons with disabilities are not well coordinated and not involved with disabilities. Local or city governments need to carry out disaggregated data collection efforts, including data on persons with disabilities who can access various development programs such as labor quotas in government or private companies, or assessment of the needs of persons with disabilities to be able to map out program planning. The initial stage of success in protecting the rights of persons with disabilities is knowing who or what type of disability they have and what they need, so that the programs made are right on target. Although many programs have been carried out, they still do not provide significant benefits for persons with disabilities. This is because persons with disabilities or disabled organizations haven't been involved in various processes of planning, implementing and monitoring development evaluation, including in conditions of the COVID-19 pandemic and disasters. It is necessary to review all preventive measures so it can also be enjoyed by persons with disabilities. APEKSI and UNESCO also support efforts to fulfill the rights of persons with disabilities and create an inclusive city, especially in handling disabilities. APEKSI continues to consistently support the protection of persons with disabilities, starting with holding seminars and webinars, holding high-level mayoral meetings to discuss policies and practices of inclusive cities, holding working group meetings or POGJA towards inclusive cities, and various other programs. A number of government activities in fulfilling the rights of persons with disabilities has become an important information for the sharing process with other city governments. including the involvement or collaboration of organizations of persons with disabilities in various activities in the region, such as the Indonesian Women with Disabilities Association. Some of the programs that have been carried out by UNESCO, including collaboration with a network of mayors and collaborative programs with local partners such as the NGO Kota Kita. By conducting surveys, collecting and managing data that leads to the protection of disability rights. Some of them are in Banjarmasin and Solo. This program is also adopted by the Ministry of Social Affairs of the Republic of Indonesia. To harmonize the program, APEKSI and UNESCO are collaborating in the fulfillment of disability rights in the context of the COVID-19 pandemic and the current disaster, namely conducting assessment, compiling policy papers, campaigns or education, training, and policy dialogue. From the results of a brief assessment by APEKSI and UNESCO, a number of recommendations are proposed, including this is the job for all of us. Let's together create an inclusive society by paying attention to the rights of persons with disabilities.